Dear viewers, subscribers, budding nursing and paramedical professionals, Assalamu alaikum warahmatullah. Welcome back to your own channel, Advanced Nursing Theory and Practice. Today we are back again with the subject of Nursing Foundation, and today's topic for discussion is Code of Professional Conduct for Nursing Professionals. This will be the part 5th of Code of Ethics series, and this will be final part of this video series for Code of Ethics. So this will be taken up by me. So before going to the actual topic of code of professional conduct for nurses, we must know what code of conduct is. So while going through the definition, we can see that personal conduct is behaving with a real sense of dignity and respect for the service given, for the patient, and for those whom we work with. So simply it means that we must have a dignity and respect for all those with whom we are collaborating in delivering quality patient care or services, or communicating in terms of delivering best or quality nursing care for the patient, or managing the ward or activities that we are assigned. So we can say code of professional conduct helps nurses in developing quality professionalism and accountability. Moreover, we are well known about the fact that we are dealing with the human beings, and wherever human beings are involved while providing services, ethical consideration comment existence. So here we have to deal with human beings, and we have to preserve their values, their rights. We have to respect their autonomy and relationship. Now, what are the purpose of professional conduct? The number first purpose is that we have to inform both a nurse and the society of the minimum standards for professional conduct. We have to set limits, minimum limits, what we are planning for the patient in terms of services. Then we have to provide regulatory bodies a basis for decisions regarding standards of professional conduct. We have to set some standards below which we can say that the care provided or the services provided are substandard, and we have to check whether standards are met and approve them up to the mark by measuring their quality in terms of quality assurance or quality management. Then the next purpose of professional conduct is that the code of ethics helps us in the protection of rights of individual, maybe a group of individual, a family, community, and rights of the nurse as well. So by following code of ethics and professional conduct, we safeguard patients, families, communities, and co-workers and ourselves. Then what are the various elements of professional conducts? Before going to discuss these one by one, we will enlist them. What are the various elements that we have to study in professional conduct for nursing professionals? Number first is professional responsibility and accountability. Number second is nursing practice. Number third is communication and interpersonal relationship. Number fourth is valuing human being. Number fifth is management, and number sixth is professional advancement. So we are going to discuss them one by one. So first will be the professional responsibility and accountability. Here a nurse has to appreciate the sense of self-worth and nurtures it. She must know about understanding self. She must know about self capabilities, abilities, and what amount of care or a service she or he can provide to a client. She has to maintain the standards of personal conduct that will be reflected or credited to her professionalism in terms of profession. Then she has to carry out the responsibilities within the framework of professional boundaries, that she don't have to cross the limits. She has to carry out the orders, she has to carry out the duties by being in the legal framework. Then he or she is accountable for maintaining practice standards as set by apex nursing body, that is Indian Nursing Council. A nurse is accountable for own decisions and actions he or she takes while delivering care. A nurse should be compassionate, practice healthful behaviors, and is responsible for continuous improvement of current practices, involving himself or herself in research, workshops, seminars, etc. Then she has to provide adequate information to individuals so that they can take their actions voluntarily or provide consent before going for any procedure so that they can make informed choices or informed consent. Number next, we can see nursing practice. Here nurses again have to perform various activities. Number first, she has to provide care in accordance with set standards of practice as laid down by apex nursing bodies or associations. Then she or he has to respect individuals, families, we can say group of individuals having different traditional backgrounds or customs or cultures. So there they have to promote healthy practices among them by adopting traditionally or culturally appropriate practices. They have to discourage the harmful practices, if any, present in a culture or tradition. They have to treat all individuals and families with human dignity. So they have to provide physical, psychological, social, emotional, psychological, then spiritual care for the clients. Then promotion and participation of individuals and significant others in the care is one of the element she has to consider. This means that we have to motivate significant others, say for example brothers, siblings, father, mother, in caring process. Then we have to ensure that whatsoever practice or whatsoever procedure we are performing, that should be safe and will should not harm the client. Then we have to consult, coordinate, collaborate, and follow up uh, appropriately the client so that the continuity of care or highest quality care or required interventions are done for the benefit of the patient. Then number next is communication and interpersonal relationship. Here nurse again has to play various important roles in this element. Number first is that they have to establish and maintain effective interpersonal relationship with individuals, families, communities. Not only this, they have to uphold, or we can say they have to maintain interpersonal relationship or therapeutic communication has to be maintained between team members, co-workers, and family members of the client. Then a nurse has to appreciate the professional role of team members. They have to work in collaboration with each other and have to discuss what kind of quality care we can provide or what kind of services we can provide in order to provide improvement in the condition of patient so that he can be rehabilitated like earlier. Then she has to cooperate with healthcare professionals in order to meet the health needs of individuals, families, and communities. Number next is valuing human beings. Here nurses again has to take some actions. Number first, she has to take appropriate action in order to protect the human beings, or we can say individuals or clients, from harmful unethical practices. So here we have to check what actions are in the best interests of the individual, and only those actions are to be taken. Then we have to encourage and support our clients so that they can speak up for themselves, or we can say they will rank up an issue if any arising while providing health care to the patient, if it is in his or benefit. So we have to value him as a human being. So we as a nursing personnel or professional has to respect and support whatsoever choices are made by individuals. Say for example, if we are providing care and patient feels that we are not up to the mark, or doctors providing treatment is not up to the mark and asks for the second opinion from a doctor from somewhere else, we must not stop him. We have to value his choice and we have to allow him. Then number fifth is management. Here, nurses has to again perform various actions or steps to be taken. Number first, she has to ensure appropriate allocation and utilization of available resources, irrespective of caste, creed, color, religion, region. Then she has to participate in supervision, education of students and newcomers or new entrants in the profession. She has to use judgment in relationship, or we can say in relation to individual competence, while accepting the responsibility, or she has to judge whether a person whom he is delegating a responsibility is capable of it or not. Then she has to check in between whether we are achieving the institutional objective or not. Then she has to communicate effectively upwards, effectively downwards and sidewards. Then she has to participate in peer evaluation, performance appraisal of juniors and evaluation of nursing services, and taking up other roles like dual job role, dual nursing roles, like by being the preceptor or lecturer and supervisor together. Then we can say that a nurse as a manager has to participate in policy decisions. Then she have to make others aware what kind of policies or rules or regulations or protocols we have to make in order to provide better quality care to the patients. And she has to follow the principle of equity and the accessibility of services for the patients. Number next is professional advancement. Here nurses has to ensure protection of human rights while pursuing the advancement of knowledge. She has to contribute to the development of nursing practice by involving in research, education, seminars, conferences, etc. She has to participate in determining for upholding own knowledge and competencies. She has to contribute to care professional knowledge by conducting and participating in nursing care research. So, or we can say she has to refine her knowledge, refine her skills by taking up some appropriate nursing courses, certificate courses, diploma courses, or she can or he can specialize in some special supra super specialty courses that can be available at an institute or outside his or her institute. So this was all about today's topic. Thank you for being with us. Do not forget to share, subscribe and support your own channel. Your suggestions and valuable comments are welcome at aminhabib3@gmail.com, ejazmanzoor.ahmad@gmail.com. Thank you once again.